Hi, Ramsey Choucair. I am a board-certified plastic surgeon in Dallas, Texas, and we're continuing with our series on body contouring issues. The next subject that we're going to try and address is the different types of liposuction or suction lipectomy that are available. I'm going to kind of name them off, and I'm sure many of you have heard of them, and I'll try and go through each one and tell you what or why we would or wouldn't use them. The first one I'll mention is what we call traditional liposuction. It is a stainless steel tube with holes at the end, usually of a small diameter, 2 to 3 millimeters, that is then inserted through a small incision in the skin and attached to a tube that pulls a suction and vacuums, basically the best term I can use, the fat out. So if that's your muscle and that's your skin, the fat is gently removed with the skill of the surgeon directing the tube to carefully and precisely remove the fat. That's traditional liposuction, and that's what most surgeons who do a significant degree of liposuction use because it's precise and it's predictable and it's time-tested. Now, there are many other techniques that surgeons may use. I'll name them. One is laser liposuction. One is water-assisted jet liposuction. One is ultrasonic liposuction. These are just other techniques that allow you to remove the fat in a different way. Laser vaporizes the fat and turns it into somewhat of a liquid. You still have to take a traditional liposuction hollow tube cannula to suck that fluid out. The second would be ultrasonic liposuction, which vibrates the fat loose. You still have to take a traditional cannula and suction the fat out. Water-assisted jet liposuction emulsifies the fat with a water jet system, and you still have to suction the fat out. So why wouldn't we use those different things? Well, it's the same technique that I say if I'm doing a facelift, a patient usually doesn't tell me which pair of scissors to use. Well, it's the same concept. These are just different tools to achieve a goal, to achieve an expectation of reducing the fat content. So why do most of us use traditional liposuction? Because it's time-tested, it's predictable, and it's typically the least traumatic. Remember, with laser and with ultrasound, you're creating a heat environment that sometimes creates heat problems. And heat problems mean sometimes contracture or scar tissue in the skin or in the fat. So surgeons use different techniques. You should just check with them about why they use their technique and know that you can achieve a significant improvement with any of these different techniques. But most surgeons use traditional liposuction for the reasons I mentioned. I hope that gives you an overview of the different types of liposuction.